It's YouTube. It's a surgical.
Okay, so I'm going to enter the patient's room. I'm going to sanitize my hands. And I'm going to be having a sensitive conversation, so I'm going to pull the drapes for privacy.
Yeah. So it still is.
Hello, Mrs. Smith. My name's Darcy, and I'll be your nurse today. Can I just confirm your identity? All right, I'm going to check your wristband. Okay, and can you please give me your name and date of birth? Okay, thank you. Okay, so today I have an order to give you your gastrostomy feeding. Have you had that before? Yes, you have it multiple times a day? Okay, so have you had any bad reactions to that before? No, you haven't? Okay. Do you have any allergies? No, you don't? Okay. So I'm going to just assess you to make, I'm going to do a bowel assessment, no, a full abdominal assessment, and I'm going to assess your skin for dehydration. Okay, so first, can you just open your mouth for me? Okay, your mucous membranes are pink and moist, they look good. Can I have a look at your nares? Okay, those are moist as well. I'm going to check your capillary refill. Okay, less than 3 seconds. That's good. I'm going to check your skin turgor. Okay, returned in less than 3 seconds. That's also good. Okay, and if you can just lay back for me, I'm going to do a full abdominal assessment. I'd like to make sure that your bowel sounds are active, just to make sure that there's no obstructions. I wouldn't want to give you your feeding if you had those. Okay. Raise that up. Okay, I'm going to take my stethoscope and just hang it around my neck for a second. So what I'm going to do first is I'm going to ask the patient if they need to void, because I'll be pressing on the area around your bladder. No, they don't need to void. Okay, so I'm just going to palpate. Okay. Everything is soft and feels like it should.
Yeah.
And now I'm going to auscultate just to make sure there are bowel sounds present.
But you would have auscultated first.
Auscultate first.
Yeah.
Okay, present bowel sounds, so there is no bowel obstruction. Okay, Mrs. Smith, I'm just going to go prepare your tube feeding, and then I'll be right back to administer it out, okay? And here's your call bell if you need me in the meantime. Okay, that back up. Okay, so now I'm going to go to the nurse's station. I'm going to grab the doctor's order. It says 100 milliliters of 2-cal over an hour, so 100 milliliters per hour. So I already have that set up in my bag, and I have the expiry date on it. So what I'm going to do now is I'm going to gather my supplies and go back to the patient's room. I'm first going to, so I'm going to confirm their identity again, just to make sure that nothing's changed. Okay, and can you give me your date of birth? Thank you very much. Okay, are you still feeling fine? Yes, nothing's changed in the last couple minutes? No? Okay. So I need some gloves.
It's fly. Go away.
Okay, I have 2 gloves here. So I'm going to need a syringe with 30 milliliters of water to flush. So what I'm going to do is I'm just going to pre-fill that syringe. It'll make it more convenient for use later. Cap that again, so that's there. Okay, so I'm just going to go back. I should have checked the surgical site earlier, the gastrectomy site. It looks to be fine. There's no irritation, swelling, redness, none of that. Okay, it's a healthy site. So.
Is that me?
Oh!
It's got my teeth.
So what I'm first going to do is I'm going to check the pH. I need to make sure it's between 1 and 5. If it is over 5, that means the tube is not placed in the correct spot. Okay, so I'm going to put on my gloves because I'll be dealing with gastric contents. Okay, so I'm going to remove the plunger and pinch so I don't have any gastric contents or air going into the stomach. Okay, I'm going to hook this up. Okay, I'm just going to retract about a milliliter just to check the pH. Okay, I'm just going to put it on my little dipstick. Okay, a pH of 3, that means that the gastrectomy tube is in the right spot. It's in the stomach. So now what I'm going to do is I'm going to check the GRV, which is the gastric residual volume. And I want to make sure that it's under 250 milliliters, otherwise I will not be administering an enteral feed right now. Okay, going to aspirate. Okay, there's only 30 milliliters of GRV, so I'm going to push that back in. There we go. There we go, unhook. Keep that clamped. Garbage. When was I supposed to flush?
Now you
Yeah,
flush.
GRV. Okay, so before I put the plunger back on, I'm going to flush my tube with 30 milliliters of water.
Make sure that lid's not on.
Okay, putting in my 30 mils, it's in. Oh, I had the cap on. So I wouldn't do that, I'd take the cap off. Okay, there's 30 mils in there now of water.
Maybe that's what I was doing. Spraying everywhere.
I'm going to put the plunger in. I chose to use water instead of sterile water because the patient is not immunosuppressant. Okay, I'm going to put that back. Get rid of my gloves in the garbage. Hand sanitize. Put the bed rail up, lower the bed. Make sure that it's 45 degrees before I start the pump. Get rid of all of this. Okay, now I'm going to go over to my pump. With the doctor's order, it says 100 milliliters per hour. I'm just going to confirm that it is 100 milliliters per hour. I'm going to put on a new pair of gloves because I'll be touching, could come into contact with gastric contents. So I have my gloves on now. Remove the plunger, pop off the plunger, the cap, hook it up, make sure that's good, and then I'm going to press start.
Did you already put the food in the
You
bag?
perv.
Did you already put the
Oh,
food
sure, I
in the
wasn't
bag?
looking at that. I was looking at the thing, how it was attached.
All right.
Okay, now you do one more thing.
Okay. To do a post assessment, I would come back, I would ask her how the tube feeding went. She said it went fine, and just to make sure that there's no buildup in the tube, I would put my gloves back on, unhook this, unhook the tube feed, and administer another 30 ml flush, just to flush the tube. Okay, and plunger back in.
And then for the SAT, you would?
I would put the call bell here, and if you experience anything that doesn't feel normal to you, then you just ring that call bell and I'll be right back.
And then you document.
And then you document. And that
Document.
took